Welcome back, everyone. I'm Dorothea Howard, and I'm the host of Let's Talk Sarcoidosis. Alongside of me is my co-host, Mr. Richard Hanna. How are you today, Rich?
I'm doing great. How are you doing, Dorothea?
I'm doing well, thank you. I'm so excited about our guest in the studio today, back by popular demand. We listened to all of the viewers out there. I have Dr. Chen back again. He is Dr. Edward Chen from Johns Hopkins, and he actually manages the sarcoidosis patients.
Well, I help take care of some of the sarcoidosis patients at the clinic.
Yes.
Along with Dr. David Muller, who remains the director of the clinic. Yes.
Okay. Well, welcome back, because we know
Welcome
you're a
back.
busy man, and we definitely appreciate it. So I won't even hold you up. I'm going to just start asking the questions so we can try to get as much in as we can. So, Dr. Chen, what does it really mean for a person to have sarcoidosis?
Right. Well, so to answer that question, I think it kind of really depends on each person's situation. And what I mean by that is that, you know, for each patient, it's always important to consider where their sarcoidosis is, what parts of the body are affected by sarcoidosis, how active the disease might be in each of these places, and overall, you know, taking a step back and seeing whether or not it needs to be treated.
Okay.
And because of that, you know, that's probably one of the reasons why you might hear about different stories from different people talking about their experience with sarcoidosis.
Okay.
And so, again, there may be different places where the body that might be affected by sarcoidosis. To answer your question, it'd probably be best if we kind of talk about the most common examples of sarcoidosis, and then, you know, we can then try to adapt our thoughts to the less common examples.
Okay. So with that being said, can we talk about the different parts of the body that sarcoidosis involve?
Yeah. So probably the easiest, most straightforward example of sarcoidosis to talk about would be sarcoidosis involves the lung and the lymph nodes in the chest, right? So, and probably what's has been experienced by many of your many people in the audience would be that most patients, and what I mean by that, maybe at least 75% of patients, all patients with sarcoidosis, have some evidence of sarcoidosis in the chest.
Okay.
Some patients may have sarcoidosis involving the lungs that could lead to, you know, cough and shortness of breath. Some patients may have sarcoidosis involving the lymph nodes in the chest that might cause, you know, chest pain in some patients.
Okay.
And other patients may have both of these things areas involved. And so, you know, again, in terms of whether or not the sarcoidosis actually needs to be treated, I think it needs to be accounted for on a case-to-case basis.
Okay.
Some patients may have evidence of sarcoidosis that's confirmed on a biopsy, but you know, it may be something that really doesn't either bother them too much, and maybe the extent of it may not be that great on their chest x-rays or chest CT scans. And so their doctor may work with them and say, well, it's not clear how active it is at this point. It may be worth watching and seeing what happens over the first several months.
Okay.
And there are other patients where they're clearly much sicker from their sarcoidosis, or their lung functions may be already very bad by the time they're found to have sarcoidosis.
Right.
And in those cases, it may be worth treating first and seeing what gets better. So I think the point really is that the first step is to kind of, for the patient, really work with their doctor to see how extensive, how active the sarcoidosis might be. And that will give a better indication of whether or not treatment is necessary.
Okay. So can you just explain a little bit what is pulmonary sarcoidosis for those who may be newly diagnosed?
Right. So that term just simply means this most common form of sarcoidosis, most common category. Pulmonary sarcoidosis is the term that's used to describe patients who have sarcoidosis involving the lungs or lymph nodes in the chest. Basically, sarcoidosis in the chest, the most common type of presentation.
Okay.
And another word about trying to figure out, you know, when or why to treat patients with sarcoidosis. Sometimes it's not as clear as to how active the sarcoidosis might be, or whether or not the patient needs to be treated. And the situation where it's a little bit more tricky would be patients who actually who have evidence of a lot of scarring in their lungs. And so obviously their chest x-rays, it looks pretty abnormal.
Right.
They may have coughing and shortness of breath, maybe just from the scarring itself, which we know scars are permanent changes. And where the trick is that these permanent changes, these scars, really will never get better with any dose of medication.
Wow.
Right? And so the difficulty sometimes would be for the doctor to try to figure out, whether or not there's actually evidence of active sarcoidosis hiding behind the areas of scarred lung that they're seeing with the chest
wow.
X-ray. And so sometimes it may take a few weeks or maybe a few months for the patient who was just found to have sarcoidosis to work with the doctor and get a sense as to how active the disease really is at this point.
Wow.
And what are the stages of sarcoidosis?
Right, so that's a good question. So the term stage actually is an issue that a lot of patients bring up just because the term seems to generate a lot of concern.
Right.
And mostly it's because stage is commonly used in conversations about cancer these days, right? So the way we usually hear about it is that stage or higher numbers of stage for cancer, like stage 3 or stage 4, usually have a bad prognosis associated with them. And that's certainly true for cancer. But when we use this term stage for sarcoidosis, it has a very different meaning.
Okay.
So the term stage in sarcoidosis was first popularized by Dr. Scatting. He was a British physician in the 1950s, used the term stage to basically place patients with sarcoidosis in different categories based on how what their chest x-ray looked like. And so basically what he proposed at that time was stage 0 chest x-ray meant a normal looking chest x-ray.
Okay.
Stage 1 meaning that it was able to see evidence of lymph nodes being enlarged off the chest x-ray.
All right.
Stage 2 meaning there was evidence of both lung disease and enlarged lymph nodes on the chest x-ray. Stage 3 meaning just lung disease without any enlarged lymph nodes in the chest. And stage 4 meaning obvious scarring seen on the chest x-ray. And so the issue is that patients who have, regardless of what their stage is, they may feel well or do better regardless of what the chest x-ray really looks like.
Okay.
And so we've all met patients who might be told they have a stage 3 chest x-ray, for example, that otherwise feel relatively well, and actually maybe their pulmonary function, lung function tests don't look all that bad. And on the other hand, maybe a patient who has stage 1 chest x-ray, which means only lymph nodes enlarged without much lung disease on the chest x-ray, they may actually, sometimes they may actually be suffering from weight loss, fevers,
wow.
that kind of stuff. And so the use of the term stage really has no bearing on how well or unwell the patient is.
Okay.
Doctors usually need other information to kind of help gauge that issue.
Right.
Okay. So the stage really doesn't tell the severity of it.
No, it really doesn't. Again, more other information is necessary. If we're just talking about patients with pulmonary sarcoidosis, sarcoidosis that might affect the lungs or stuff in the chest, the chest x-ray stage by itself just simply tells you what the chest x-ray looks like. Doesn't tell you if they're having shortness of breath even, or if they're wasting away from other symptoms. And also, so some basic other information may include things like lung function tests, pulmonary function tests that might help gauge with that.
And like with the stage, does it tell if the person really needs treatment?
No. So again, stage just basically puts a patient to a category based on what their chest x-ray looks like. And other information is necessary. So some patients, including things, for example, just breathing tests, lung function tests, a very basic piece of information. And like I mentioned before, if a person has a chest x-ray that doesn't show very much stuff in the lungs, if their lung function tests don't look all that bad, and they're feeling relatively well, it might make sense for their doctor to just watch and observe them for a few months. On the other hand, if their breathing tests look pretty bad, and if they have a snowstorm on their chest x-ray, they may need to be treated up front. There are other things to maybe consider too, something that either the chest x-ray or maybe even the breathing test may not give a complete picture. And so for those patients who the chest x-ray doesn't look that bad, the breathing test might look pretty normal, but they're still feeling pretty awful,
Yes.
particularly with shortness of breath. But like I mentioned, there may not be evidence of real lung disease. Then you need to take a step back, and the doctor may want more tests, maybe to make sure that there aren't any other problems. Like, for example, a heart problem, for example. So an echocardiogram might be useful to sort out if there's another reason for a person to be more short of breath, even if they have no evidence of lung disease from sarcoidosis. Or other types of problems like sleep apnea that sometimes can either be present when the patient's first diagnosed or maybe develop as of a complication from treatment.
Wow.
So sometimes, again, the patient kind of needs to keep in touch with their regular doctor to see if everything or what they're experiencing can be fully explained by sarcoidosis or not.
I know, Dr. Chen, there's a lot of viewers that are really concerned about the different types of treatments out there for sarcoidosis. So can you tell them what are the best treatments for sarcoidosis?
Well, so in this day and age, I hate to say it, but prednisone still remains the best treatment or the most common treatment for sarcoidosis.
Okay.
And there are a few reasons for this. The main one really being that prednisone, the most common corticosteroid that we use, still remains the most effective treatment for sarcoidosis. So a proper dose or an appropriate dose of prednisone usually should be good for treating most cases of sarcoidosis. And what I mean by an appropriate dose would be that there's a sort of range of doses that would be expected depending on where the sarcoidosis is in that given person. And this is certainly a situation where more is not better. That too high of a dose certainly may cause basically too many side effects, essentially. Too low of a dose also may not be enough to control the disease. So getting back at our most common example for pulmonary sarcoidosis, so most cases of sarcoidosis that principally involve the lung or maybe even the skin should be controlled with a dose of prednisone around 10 to 20 milligrams a day. If you run into situations where a patient seems to always have problems every time their dose is reduced below, say, a higher dose, like 40 milligrams a day, or they need 80 to remain feeling well, then usually their doctor will probably take a step back and again, run some other tests to make sure something else is not causing these problems. That basically is not behaving like pulmonary sarcoidosis. They may look for an infection, for example. And in other patients, if part of the problem is that as their dose goes below, say, 10 milligrams a day, that their sarcoidosis seems to increase in activity, then that certainly is a situation where we might consider adding some other types of medications to help keep their disease stable with lower doses of prednisone.
Okay. Why is that? Because I know there's a lot of viewers out there, and they call this prednisone like the monster medicine. I mean, they have bad horror stories about the prednisone, the fat drug. Or
so, prednisone still remains, again, the best drug to use, particularly in patients who are newly found to have sarcoidosis. I guess that's another way of thinking about this, how to fit prednisone in with sarcoidosis. And again, if a person's just found to have sarcoidosis, and particularly if it's not clear how active the sarcoidosis is, you usually want to use a medication that you know should work. All right. And so and what I mean by that is most other medications other than prednisone that we might use in some cases for treating sarcoidosis, other than prednisone, these medications generally are effective less than 50% of the time. So again, if you're starting on a new course of therapy for a person just found to have sarcoidosis, and if you choose to use a medication that only works half the time and nothing changes in, say, 2 months, then you're not sure if it's because the medication really didn't work. So that's one reason. The second would be that these other, unlike prednisone, where it actually ends up being one of the safer medications, we generally don't have to order any extra blood work safety tests for prednisone. That most of these other medications, other than steroids, do require blood work usually once a month, just for monitoring, but it's just there's some other additional concerns. So basically, for these reasons, we do still like to use prednisone in the beginning. And it gets back to this issue of just making sure they're on a sort of like a proper or appropriate dose, not too high, but certainly not too low where it may not be doing, have enough of an effect.
And I was just about to ask you that, like, are you saying that doctors, should not be using higher dosage or, a prednisone?
Well, so again, there are expectations as to how sarcoidosis might behave or respond to prednisone or respond to certain doses of prednisone depending on what parts of the body are involved. So again, the most common situation would be pulmonary sarcoidosis.
Right.
And again, most cases should be controlled with a dose between 10 and 20.
Okay.
There are certainly some forms of sarcoidosis or some parts of the body that when they're involved with sarcoidosis might actually be expected to need higher doses. And so these often include, like, say, sarcoidosis in the brain, sarcoidosis in the heart, or sometimes even some patients who have sarcoidosis in their sinuses might require doses higher than 20 milligrams a day that we would, that otherwise would be sufficient for run-of-the-mill, long skin sarcoidosis.
Right.
So it's not that we never use higher doses. It's just that it depends on the situation. So if you're just dealing with the most common pulmonary sarcoidosis cases, that again, most cases should be controlled with 10 to 20 of prednisone.
Okay.
And if you run into a situation where a patient seems to need much higher dose than 20, their doctors should take a step back and make sure something else is not adding to their symptoms.
Okay.
And with that in mind, are there other medications that can be used to treat sarcoidosis?
Yeah, so there are certainly other medications that that are used to suppress the immune system to control sarcoidosis that essentially have been borrowed from the rheumatology clinics. There are many, but the most common ones may include azathioprine, mycophenolate, and methotrexate.
Okay.
And again, these medications, although they may not have prednisone-like side effects, there's certainly other concerns that do require regular blood work for monitoring.
Okay.
And again, since they aren't as effective as prednisone for controlling sarcoidosis, they're usually best used after you've figured out how much better a person can get using the more effective prednisone.
Okay.
And these other medications are also better used for more long-term treatment. Usually seeing if you can trade some of the prednisone for the second-line medication, because you've already hopefully figured out how much better a person can get with the prednisone. And so you try to maintain that well state as you cut back the prednisone and started the second medication.
Okay, so they'll be taking them both at the same time.
They would be. And it's just basically a way, hopefully, of keeping their disease under control as you cut back on the prednisone.
Okay, and what should patients do to take care of themselves if they have sarcoidosis?
That's a big one.
Right, yeah, so that is an important question.
Yes, that's a big one.
And so regardless of whether or not a patient needs to be treated with prednisone or if whether or not they need to be treated for their sarcoidosis, basically general recommendation that all patients should try to conduct a healthy lifestyle.
Right.
And really importantly would be to try to remain as active as they can.
Right.
There are many reasons for that, one of which actually is that if they actually do have bad enough sarcoidosis that needs to be treated with prednisone, regular exercise, even with walking, would be one of the better ways of trying to avoid problems from their medications like prednisone.
And that was my next question, because I'm sure a lot of people wonder, is exercise safe for people that have sarcoidosis?
Right. So in general, for most patients with sarcoidosis, exercise, particularly if you're starting from scratch, starting with walking, should be safe.
Okay.
Obviously, there's no way for us to talk about all cases here on the show, and so I think in terms of singling out some important examples, so if a person knows that they have either severe lung disease or heart problem or even both, then they probably should review their situation with their doctor to see if there are some concerns about exercising beyond walking.
Right.
For patients who have bad lung disease, they also should ask their doctors to make sure if they need oxygen when exercising.
Okay.
And the oxygen issue is an important one, because whether or not a person needs oxygen actually depends on a measurement, not whether or not they experience shortness of breath.
Okay.
And that whole discussion may take up a whole half an hour by itself.
And you'll have to come back again.
No, it's just something that you have to measure in order to see if it's necessary or not.
Okay.
But again, it would be important, for a person to or to exercise regularly. And again, not just so that they can get into better shape or control their weight, but also if they exercise on a regular basis, say a couple times a week, essentially what they're doing is they're just sort of testing their lungs a couple times a week.
Right.
And most doctors will think that a person who's active on a regular basis probably stands a better chance to be better in touch with their body and be able to maybe detect sooner
Right.
and whether or not there's a change in their health status. So for example, if it was a patient who was newly diagnosed with sarcoidosis but thought to have a very mild case,
Right.
So they're not being treated, but they're going to be monitored by their doctor, it certainly would be good for them to continue to exercise regularly. They may stand a better chance of, even before the tests are repeated,
Right.
maybe detecting that something's different about their breathing earlier if they're, again, exercising
Right.
regularly.
And that's something that I do, as you see.
Right.
But back to the prednisone. I know that people really want to know, what are some of the signs that you look out for while taking prednisone?
Good question.
Signs, well, so the common concerns with prednisone, I think the number one thing that patients are concerned about when they talk about it would be weight gain. And so certainly prednisone can cause changes in people's appetite, and it tends to be what we call dose dependent. So certainly at higher doses, people certainly can be very hungry. They may not necessarily be hungry right away, but maybe after 2 to 3 weeks after starting it, they may notice a difference, particularly if they have a reason for high dose of prednisone. So again, if they have cardiac sarcoidosis, sarcoidosis in the brain, they may be at high enough dose of prednisone where they can't get around the hunger issue.
Okay.
For other patients who are not dosed quite that high, again, if they have pulmonary sarcoidosis dosed with a low to moderate dose, they may not necessarily think that they're that hungry, but I think they may not be still eating more calories than they need,
Right.
which probably accounts for most of the weight gain. So it get back to the issue that it would be useful for them to try to remain as active as they can.
Okay.
Other issues may include making sure, again, they have regular follow-up with their regular doctor to make sure they don't have issues either with high blood pressure, high blood sugar, diabetes,
Right.
either as a new problem or, particularly if they have a family history of either of these problems.
Right.
And I guess another concern would be in terms of preventing other things that steroids could cause, like accelerated bone loss.
Okay.
So most patients who are newly placed on prednisone probably should get a bone density study to look for
Right.
osteoporosis. And they also should be screened for vitamin D deficiency, which is not uncommon, actually, even in the
Right.
United States.
Okay.
And again, regular exercise will help preserve bone
Right.
density as well.
So let's talk about the vitamin D, because there's a big controversy and so much information on the internet. And so can you clear that up about, should patients be taking vitamin D
Right.
who has sarcoidosis?
So actually, this is another set of questions that comes up pretty frequently.
Okay.
The issue of sarcoidosis and vitamin D appearing in the same sentence. And so what it ends up being are a couple of things. As I mentioned before, it's important for patients to be screened for vitamin D deficiency, particularly if we know that they need to take prednisone, a medication that can thin their bones, just because vitamin D deficiency still happens in patients, can happen in patients with sarcoidosis, and is a preventable cause of bone loss. That being said, some patients, not all, but there are some patients with sarcoidosis who may experience or are found to have very high levels of calcium in their blood, or also newly start to have frequent problems with kidney stones.
Right.
And so for those situations, certainly there would be some suspicion that they have some problems handling calcium. And so for those patients who have problems with handling calcium, who have sarcoidosis, what the problem lies would be how the vitamin D is processed. And so what I mean by that, vitamin D in the diet comes in an inactive form. And it's also this inactive form that's what's being measured by the standard vitamin D screening blood test.
Yeah.
Normally vitamin D that's inactive that comes in the diet or in supplements and pills is converted, changed into active vitamin D, normally in the liver and kidney. These are natural processes that chemically convert inactive to active vitamin D levels. But there are certain diseases like active sarcoidosis that can enhance that conversion. So for patients with sarcoidosis, the most accurate way to see whether or not the person might have vitamin D deficiency really would be to do 2 blood tests. The standard screening blood test to measure inactive vitamin D, along with the second blood test to measure levels of active vitamin D, especially if they have this history of either high calcium levels in the blood or new onset kidney stones. So the thing is that measuring both of those tests will give you a much more accurate view of whether or not they truly have vitamin D deficiency. Again, because people with sarcoidosis can have vitamin D deficiency, and if they have that, then they certainly need to be treated like anybody else with vitamin D deficiency, sometimes with high-dose vitamin D.
Okay. Well, you know, believe it or not, we're at the end of the show. Before we end it, and if you can just answer this one question very quickly, and then we have to wrap it up. What else can patients think about, and especially when they're making travel arrangements, because there's a lot of people that travel, including myself.
Right.
So very quickly, if you can just tell them what should they be doing, making the travel arrangements.
Right. So again, in general terms, for most patients with sarcoidosis, there shouldn't be any general concerns about travel. Picking out a couple of more common situations that do come up. So again, for patients who have severe lung disease, and particularly if they need oxygen, they most likely will need to bring their oxygen wherever they go. And so their local doctor can usually help them, with making arrangements for that. And particularly if they're flying somewhere, if they need oxygen at sea level, they'll need oxygen on the airplane. There are certainly some situations where patients who have scarred lungs or significant lung disease, where they also may be told they shouldn't go diving. And so with that, they're best to basically review that issue with a pulmonologist, a lung doctor.
Thank you so much, Dr. Chen. We definitely appreciate you being here.
Yes.
And I know the viewers will love the show because you've answered a lot of questions for them. Until next time, I want everybody to stay positive, take care of yourself, like Dr. Chen said. If you need to, have some follow-up, contact Dr. Chen at Johns Hopkins. And until next time, as I always say, for all the fellow Sarcoidonians, we all have sarcoidosis, but sarcoidosis doesn't have us. Be blessed, and we'll see you next time. Thanks for watching.